If you're not saturated, then I again repeat. I always say, please follow the guidelines. Any new drug comes, unless it's part of the guidelines, please do not use it. If you're sitting as a professor in All India Institute of Medical Sciences or at PGI Chandigarh, you're authorized to do that. Short of that, as a very small private practitioners, we have no role to contribute to that kind of research. The standard treatment guidelines serve as an important vehicle in assisting the doctors in decision making and providing the best treatment options to her patients and to yourself. I repeat again, this is vaccines for women that includes you people as well and her family. Now this slide summarizes everything. Tdap, I've just now said. TD, I again repeat, it is the practice everywhere. TT छोड़कर अब TD की गाड़ी पे चढ़ जाओ, पैसे ज़्यादा नहीं है इसके। रैशनली मैंने आपको बता ही दिया है। इस उम्र में अगर हम लोगों को डिप्थीरिया हो जाएगा तो मरे ही मिलेंगे, बचा नहीं पाएगा कोई। Hepatitis A, in case if you find it can be given during pregnancy. Same as hepatitis B. Meningococcal, pneumococcal not to be given during pregnancy unless you find there's so much of things are there that the adverse reaction really do not matter as far as the safety of the life is concerned. HPV, we all know it has not to be given during pregnancy, MMR not to be given during pregnancy, and varicella not to be given during pregnancy. I again plead for HPV vaccination for a woman. Take itself and aapki beti, aapki responsibility. Rashmi and her daughter again plead to you that it is your responsibility to safeguard your daughter and yourself. I will just speak about 2 words. This is my 3rd presentation to this August gathering on the chicken pox vaccination for women. I repeat again, why I am presenting this particular thing, I'll just take 2 minutes. Chicken pox is caused by varicella zoster virus. If it occurs in first trimester, the varicella infection during the first and the second trimester may increase the risk of congenital varicella syndrome. Just like rubella. Rubella, if one person gets it in the first 3 months of pregnancy, we already know that the 50% of the babies will be malformed, and that's why it's a universal practice to terminate the child. So I repeat again, as far as the varicella infection is concerned, in the first and second trimester may increase the risk of congenital varicella syndrome. If it occurs in the 3rd trimester, there's a chances of maternal pneumonia. If it occurs in perinatal varicella, it means 5 days before the delivery and 2 days after the delivery if you have had a chicken pox. That in that particular case, the child happens to have the risk of having a chicken pox. How it is different from rubella, which we all scare. When I am at rubella, every year, I get dozen cases where the senior gynecologist with MS or MD degree, IgG is positive and they ask for MTP. Left and right, just about 7 days back. अगली बार कहूँगी तो मैं नाम लेके आऊँगी. IgG is good. G is good. Do not suggest MTP. G is good. लखे अपने क्लिनिक में 10 जगह लगा के रखो कि G is good. Now, as far as varicella infection is concerned, if it happens in the first trimester, intrauterine infection is seen in 25% of patients. And the congenital anomalies can be expected in approximately 12% of the infected fetuses. I don't have to really go into anomalies. These are the picture of congenital varicella syndrome. If it occurs in third trimester, 20% will have pneumonia, 40% will require mechanical ventilation, and mortality is there up to the 15%. This is prenatal varicella, means if the woman gets 5 days before the delivery and 2 days after the delivery. This is the kind of classical case of neonatal varicella is there. So if you want to protect this particular woman, the best way to protect against chickenpox is to get the chickenpox vaccination 1 to 3 months prior to pregnancy. If she's already pregnant, so if you want to protect yourself, then you vaccinate your family members. So indirectly you will get it. And postpartum, as soon as pregnant woman delivers her baby, she should be vaccinated against chickenpox with the first dose and the second dose at 6 to 8 weeks postpartum. If you take 1 dose, the seroconversion is 85%, and if you take 2 doses, the seroconversion is 100%. Thank you very much.